Hi, everyone. We've been getting a lot of questions regarding the COVID-19 vaccine. And so we were able to get Dr. Bradley, our medical director, and Dr. Winchell, our base station medical director, as well as our physician that's overseeing our wellness exams, to be able to provide insight on some of the recommendations on getting the vaccine. So we got a list of questions that we've been getting from the troops that we've been hearing a lot of similar questions. We put a pretty comprehensive list together, and we're just going to start going back and forth with Dr. Winchell and Dr. Bradley and answering some of the questions we've been fielding. So I'll start with you, Dr. Bradley. If I had a COVID-19, if I've had COVID-19 and have recovered, can I still get the vaccine?
Absolutely. So one of the things that we don't know about COVID-19 is how long the immunity actually lasts from the infection. And so currently the recommendation is to allow you to get a vaccine if you have recovered from COVID-19.
Okay, very good. Thank you. Okay, next question for you, Dr. Winchell. What if I had a recent positive COVID-19 test or symptoms of COVID-19?
So for that, so I would wait. So the recommendation is you wait till you have symptom resolution, right? Before you would get the vaccination, but that would not stop you from getting the vaccination. So I would say for the current recommendation is you wait for your symptom resolution to occur. So you're no longer ill, you don't have the symptoms, you're not taking medications to mask any symptoms, and then to proceed with the vaccination.
Okay, thank you, Dr. Winchell. Dr. Bradley, can I get the virus from the vaccine?
Quick answer to that is no. So the virus is not a component of the vaccine itself. The vaccine contains messenger RNA. So this is something that helps to stimulate an immune response in your body so that if you were to get exposed to COVID, your body would have a pre-made kind of antibody or immune response. So again, no viral particles or virus in the vaccine itself. So you definitely cannot get COVID from the vaccine.
Okay, and a follow-up to that, is the vaccine live?
Again, no live viral particles at all. So a completely messenger RNA component only.
Okay. Very good. To follow up to your question, Dr. Winchell, can you go over, when we become symptom free, can you talk to us about what symptom free looks like, referencing the 10 days past symptoms?
Sure. So the current recommendations are, if you have symptoms, you test positive, you have a confirmed positive COVID test, then the recommendation is at least 10 up to 14 days that you want to be quarantined. If you're no longer having symptoms and no longer needing to take any medications to treat or mask any suspected symptoms for 3 days prior to the end of that 10 or 14 day period, then you're free and clear after the 10 to 14 day. It started 14 days. Now they've kind of moved the goalposts a little bit and they made it back to 10 days. But the key thing here is you don't want to be in the situation where you're still taking medications for fevers and aches and pains that may be masking these symptoms and therefore maybe still showing that you have active infection up until the end of that 10 to 14 day period. So you really want to be 3 days prior to that with symptom free, not taking any meds. Then you should be free and clear at that point.
Excellent. Thank you. Dr. Bradley, the next question is, what if I am pregnant or breastfeeding?
Great question. So with this vaccine, it was not tested on any individual that was pregnant or breastfeeding. However, the American College of OBGYNs has actually come out to recommend that patients who are pregnant or breastfeeding do get the vaccine. So we recommend that if this is your category, that you discuss it with your OBGYN to see what their recommendation is. But the national organization is recommending the vaccine with both pregnancy and breastfeeding. Especially during pregnancy, they've noticed a higher risk of complications and serious illness in pregnant women who get COVID-19. And so this is one of the reasons for that recommendation to still get the vaccine.
Dr. Winchell, who should get the vaccine?
So the current data is 16 years and older, those at both with the Moderna vaccination and the Pfizer-BioNTech vaccination studies. So that's where that's the data that we have. I believe it was Moderna. Gail, correct me if I'm wrong, but the Moderna was 16 and older, and the Pfizer was 18, or vice versa, right?
Vice versa. Mm-hmm.
Yeah. So that's the data that we have based on the pretty robust studies that we've done on both these two vaccinations. But those were the people in the cohort, either 16 or 18 years or older.
Okay, and with that, who should not get the vaccine?
Well, so again, the jury's still out with younger patients, right? Also, patients that have any kind of known allergic reaction to the vaccination. Again, it's kind of tough to tell unless you get the vaccination. But those are the ones that they're most concerned about as far as a possible reaction to the vaccination. With those with a known allergy, and again, jury's still out for people younger than 16.
Okay, thank you for that. Dr. Bradley, back to you. How is the Pfizer BioNTech COVID-19 vaccine given?
So the Pfizer vaccine is given as an IM or intramuscular injection. You do need to get 2 doses, 21 days or 3 weeks apart. So when you schedule your first appointment through the county right now, you'll get scheduled for your first appointment. Most of the pod sites, when you go for your actual vaccine appointment, they will schedule you then for your follow-up appointment in 3 weeks. When the Moderna vaccine comes out, that one is also 2 doses as an IM injection. However, that one is 4 weeks or 28 days apart. But both of those do require a second dose spread by either 3 or 4 weeks apart for the 2 series.
Okay. Because it's a spread out series, I'll just, you mentioned, and can you talk a little bit about the importance of keeping your vaccination card?
Absolutely. So one of the components of this vaccine is because it's new, they do recognize that there's 2 different manufacturers. So if you get a first dose of the Pfizer vaccine, your second dose has to be Pfizer, and the same with Moderna. You cannot combine the 2 different vaccine companies. And so when you get your vaccine, you will actually get an old school paper card with your vaccine information, and you will be required to bring that card back when you come for your second follow-up vaccine. All vaccines are also getting reported to ADHS, Department of Health Services. So if for some reason your vaccine card did get lost, it would be a way to recover that data so you could still get your second immunization.
Excellent. Thank you. Dr. Winchell, can you discuss what an emergency use authorization is?
So when we're looking for the approval of a certain medication or medical therapy, that has to go through certain steps as far as to make sure that it's safe for the public. They've gone through those appropriate steps for both of these vaccinations, which by independent individuals and institutions other than Pfizer and Moderna. So there was no bias as far as to push this through prematurely. The process of making this available to the public in such a timely fashion would be that emergency use authorization. However, the scrutiny that was given to both these vaccinations was still just as robust as you would see with other medical therapies. It was just unprecedented how fast we were able to do that in this time frame. But the safety monitoring and the analysis of the data, both with the Pfizer and the Moderna vaccinations, was still robust, still very thorough, and still done by an independent body other than the manufacturers and the people who are studying the vaccine itself.
Thank you. While we're talking about the emergency use authorization, can you talk specifically, Dr. Bradley, about the Pfizer vaccine?
Sure. So the Pfizer vaccine was the first COVID-19 vaccine approved by the FDA under the emergency use authorization. So it has about a 95% effectiveness for kind of treating and preventing, not treating, I should say, preventing COVID-19 infection. Again, the big difference of the Pfizer versus the Moderna vaccine is that the Pfizer vaccine requires ultra cold storage, so less than 70 degrees Celsius. And that's one of the things that has limited some of the distribution of the vaccine. So Maricopa County and Pima County are actually going to be the ones that get the Pfizer vaccine preferentially, versus the Moderna vaccine, which does not have to be kept at the same temperature. That will actually go to the more rural counties in Arizona preferentially to help facilitate vaccine across the state.
Okay. And if I wanted to do my independent research and choose one, can I choose a vaccine that I can get?
Unfortunately, no. Right now with the vaccines, because there is such limited quantity, as I mentioned, the drugs are actually, or the vaccines are being distributed to the counties by the state. So the way the vaccine distribution goes is the CDC distributes it to the state, and then in Arizona, the state distributes it to the different counties throughout Arizona. All the counties and health departments met with ADHS to kind of figure out how best to distribute the vaccine. And all of the counties agreed that the Pfizer vaccine would go preferentially to the large municipal counties, so Maricopa and Pima County, and then Moderna would go to the other ones. So when you go to your pod site right now in Maricopa County, the only vaccine that will be available to you would be the Pfizer. Both vaccines have essentially 95% effectiveness, and really the main difference is the time frame, 3 versus 4 weeks between the two doses.
Okay, thank you. And back to Dr. Winchell, can you talk about any of the known side effects?
So in both the Moderna and the Pfizer-BioNTech vaccination, when they've done the study research, the most common side effects that they had were just mild pain at the site. Like Dr. Bradley was talking, it's an intramuscular injection. So I would equate that almost like when we got our tetanus shots, when we get our tetanus boosters. Some mild, headaches, joint aches, muscle aches, because the mRNA vaccination or the vaccine particles that it's making is going to create an immune system response within our own body. So the product that vaccine is stimulating our body to make is going to activate our immune system. So it's understandable that we're going to have the symptoms of a mild immune system reaction. So that would be, again, you may feel fatigued. Some people have noted some low-grade temperature. But the one that we saw the most and that was the most consistent was, again, mild headaches, muscle aches, joint aches, and again, pain at the site. But usually those are very short limited as far as like 1 to 2 days afterwards. And then again, the symptoms resolve. It would be important to note that if a person were to get the vaccination, just to kind of plan ahead though, because sometimes, again, we're all human, we're all different. We all respond differently to vaccinations. There's nothing dangerous with regards to the symptoms that you may feel afterwards, but you may feel a little under the weather. And if that's the case, you may want to make some plans so you're not forced to, I guess, be on shift or do anything that may accentuate those feelings. But again, very short-lived, 24 to 48 hours, and you're good to go.
Okay, would you give any guidance on when you should not work if you happen to start feeling certain things?
When you should not what? I'm not sorry.
Is there a point where you should not go to work
So
post shot and becoming symptomatic?
I would say if you're having any significant response to the vaccination, which would be, again, severe headaches, muscle aches, joint aches, to the point where you feel like you couldn't carry out your duties safely and effectively, you're not helping yourself, you're not helping others. So at that point, then I would say that I would not go to work. For those, the majority of patients that have had the vaccination already, and again, I've done my own side research here with the physicians and some of the nurses here that already had their vaccinations here. The majority of them said they had minor symptoms within a few hours afterwards. And a couple of docs that I work with here, work that next night. For me personally, I'm working tonight. I'm getting my vaccination tomorrow morning. And again, I plan to work that next night at 11. Hopefully I won't have any symptoms, but that's been the experience for most of us. So I would say if you're having symptoms that are severe enough to the point where you feel like you cannot carry out your duties effectively or safely, then I would again, I wouldn't go to work.
Excellent. So the next question you kind of touched on, but This says, should I time my COVID vaccine around my shift schedule?
So the recommendation is to give yourself at least 24 hours, right? For if you're having any symptoms. Some of those that have had it here at Desert have done that. Others had worked again that evening after having and the morning and had no issues. I would say if you're having significant symptoms within a few hours after your injection, then I probably wouldn't proceed with going to work. Yes, but again, to be safe, the recommendation would be 24 hours.
Okay.
And just to tack onto what Joe was saying, a couple key things to recognize is respiratory symptoms should not be a side effect of the vaccine. So if you developed any cough, upper respiratory congestion, shortness of breath, anything like that post-vaccine, you need to presume that that is either COVID or another infection, and that's not a vaccine response. So one of the things, as Joe mentioned really well, the side effects that you're likely to see with the COVID vaccine are fever, chills, body aches, headache, fatigue. But any of the respiratory symptoms, you need to, if you develop those, you definitely don't want to go to work. The other thing would be if you develop your symptoms more than 24 hours post-vaccine, again, the realization would be that's likely not a vaccine reaction and that you need to get tested at that point. So again, you're not going to have immunity when you get your first dose of the vaccine. So if you were to develop symptoms more than 24 hours post-vaccine, then you need to presume it's potentially either COVID or another infection and do need to get tested at that point.
Okay, a follow-up, and I know I've gotten this one to what you just said. So are you saying the first shot before the second booster does it not offer any form of immunity?
I don't think they really know how much immunity. You will not get your full immunity for about 7 days post the second shot or administration. So if you think about it, if you were to get your dose this week, you wait 3 weeks, then another week after that. So really a month from your first dose is when you're going to have your full immunity, potentially at 95%. So we don't really know what happens with just the first dose alone. And so that's why it's so important that you get both doses of the vaccine.
Okay. Thank you. Next question, Dr. Bradley. The next question is, can I wait and get vaccinated in the 1B group?
Absolutely. So anyone who's in the 1A category, if you were to elect to get vaccinated, you're in the 1B category, you would still be eligible because you're still in the 1A section. So some people, because they're either out of town, work schedule, or maybe they're sick, they're not able to get the vaccine right now, or they would like to wait, they're still going to be eligible in the 1B category or later.
Okay. Thank you. And Dr. Bradley, you touched on this a little bit, but the next question is, if I get symptoms after the vaccine, do I need to get tested or stay at home? Can you just touch on that a little more?
Sure. So if you get kind of the typical body aches, fatigue, fever, chills, myalgias, headache, those symptoms, they start within 24 hours, and within 48 hours, they've resolved. You do not need to get tested. If your symptoms start more than 24 hours, or you have any respiratory components, then you definitely do need to get tested, or if your symptoms were to worsen. So just say you start getting a little bit symptomatic 8 hours afterwards, but then at 72 hours, you're still running a fever and having headache, body aches. At that point, you would need to go get tested.
Okay, and then moving forward, I'll start with you, Dr. Bradley, and transition over to Dr. Winchell on this, but prevention practices moving forward. So after the vaccine, can you talk a little bit and touch on the prevention and practices moving forward?
Absolutely. So one of the things with the vaccine is that we know it helps protect you from getting symptomatic with COVID. We really, because it is so new, don't have all the data. So it's still recommended that people use the same infection control practices. So obviously masks at all times when around other people, hand sanitizer, good hand washing, hand hygiene, etc. So we those recommendations that we've had in place for masks at all times are not going to change for right now.
Okay. Thank you. Dr. Winchell, do you want to touch on that or move on to the next question?
No, I would just reiterate what Dr. Bradley was saying, is to say we're not out of the woods yet just because we got the vaccination, right? This is going to take months for a substantial percentage of our population to get the vaccination, both vaccinations. or it's their both shots, sorry, same vaccine, both shots, in order for us to start seeing a substantial decline in the cases. So it's great that if we get the vaccination, that's helpful, but we still need to be mindful of the current recommendations until we get to that point where we have enough people vaccinated. So again, there's light at the end of the tunnel, but we're not out of the tunnel yet.
Okay, thank you for that. And I'll stay with you, Dr. Winchell, because I know a lot of people are concerned about this. The next question comes from, when will my family be able to be vaccinated? Because I know everyone's concerned about taking this home.
Sure. So they're trying to get the frontline workers, the workers and individuals who are in direct contact on a regular basis with COVID or suspected COVID patients first, get them vaccinated first. So that'd be EMS, frontline workers as far as the ER, acute care medicine, intensivists, what have you. Later in the spring, and Gail, you probably elaborate more on this, but later in the spring is what they're expected to start offering it to the general public. Is that correct?
Correct. I think the next group that we'll get are kind of the high-risk elderly patient population, so individuals greater than 75 living in congregate care settings, so kind of care facilities, and then the essential workers to include teachers. And I think the goal is hopefully by probably mid to late spring that it will be more widely available for the general public.
Okay, thank you for that. And one final question is, has there been a coronavirus vaccine created before?
Okay.
Yeah, go ahead, Dr. Winchell.
So the mRNA vaccination technology isn't new technology. We've had this now for a couple of decades. They've used that. They implemented that in the SARS-CoV-1 or SARS coronavirus 1 outbreak, as well as the MERS outbreak, was it 10 some years ago. So we've had the technology, we've played with the technology before, but fortunately in those outbreaks that it really didn't hit a pandemic level. So the distribution and the production really didn't go forward. So they've had this type of vaccination. We've had this technology for quite some time. We just haven't had to use it until 2020. So again, this isn't new technology. We're not dabbling with something in our neighbor's garage, so to speak, with regards to how we're rolling out a vaccination. We have a lot of knowledge of this technique. We just haven't had to use it until 2020. That's the only difference.
Okay. So those are all the questions I have. In summary, is there anything that you would like to say, Dr. Winchell?
No, I would say, like I said, this is a step-by-step process, and every time when I talk to the crews and colleagues in general, it feels again like we're kind of building the plane as we're flying it here with our approach to coronavirus. So we're getting better. We're getting better with our therapies. We're getting, I think the public is getting better with listening to the restrictions, and we still need to stick to that. We're just because the vaccination is out there and people are going to start to get vaccinated, doesn't mean that we should relax on our practices that we've developed as far as social distancing, hand washing, don't touch your face. Again, we will get through this. It's just going to take time. And patience is sometimes tough to have when our life is so disrupted. But this will help us. What will help us the most is if more people get vaccinated. The more people get vaccinated, the more we could get to that crucial threshold where we're going to start seeing that the effectiveness of the vaccination really take effect in our community and get us back to normalcy. It's just going to take time, and again, just being diligent about how we protect ourselves and how we protect others.
Again, I would just encourage, if you feel it's the right decision for you, to really consider getting yourself vaccinated. Both Joe and I are getting vaccinated. I'm going to, this afternoon, and Joe's going tomorrow morning. We both work in the emergency department. We're taking care of COVID patients all the time. And you guys in the pre-hospital setting, you know that you're getting exposed to COVID on a regular basis. So we just encourage you to really consider getting the vaccine, getting yourself signed up, because again, you've got at least a month before you're going to have that full immunity from the vaccine.
Okay. Dr. Winchell, Dr. Bradley, thank you very much for your time. We appreciate everything that you do for us and the partnerships we have. So thank you again, and please stay safe out there.
All right, thank you.
Always a pleasure.